Network, I'm Heidi Spleet, reporting from the Orlando Dermatology Aesthetic and Clinical Conference in Orlando, Florida.
A 9-year-old girl presented with classic signs of sexual abuse, including vulvovaginal maceration and perianal skin tags. She also had gum hypertrophy, hand eczema, mild clubbing in the fingers, and diffuse hair loss, as well as depression and apathy. What's your diagnosis?
And so when we examined the patient, we saw this area of maceration and oozing and redness in the perineal area. And first we thought of sexual abuse, but on further evaluation of the patient, we also noticed the gum hypertrophy, the eczema, and skin tags perianally. So we were exploring other differentials, and we took a biopsy from the skin tags.
We also noticed clubbing of the fingers, and the patient did not have any kind of other systemic symptoms upon reviewing the history. So we suspected sexual abuse as the initial diagnosis, but we had to rule out other diseases as well. So one of the other diseases we thought about was any condition that is associated with malabsorption, because the patient had some anemia, some hypoalbuminemia, and some hair loss. So, and when we did the blood investigation, the liver function test showed a high total protein. So we did a protein electrophoresis, which showed a polyclonal gammopathy, and this usually is a non-specific sign for an underlying inflammatory disease. One of these diseases is Crohn's disease. So this patient actually had an inflammatory bowel disease without any abdominal symptoms, and we investigated the patient by doing a colonoscopy, despite the fact that the parents didn't want to do it because the patient didn't have any abdominal symptoms. We tried to convince them, and when they were convinced, then our diagnosis was confirmed, especially that there was a fistula, and it was a low-lying fistula that opened from the lower part of the rectum into the vagina. So it was causing this irritation around the vaginal area with the maceration and the erosions that my colleague Dr. Nadya described.
We have to always remember that cases of sexual abuse are not just cases of sexual abuse, and we should for sure not label them as sexual abuse. We have to rule out systemic illnesses. And if you actually look for mimickers of sexual abuse, Crohn's disease does fall on the top of the list. So that's pretty much the take-home message, is not to forget the differentials of sexual abuse in children.